Video how to find the clinical attachment, cost of the clinical attachment, either it's free or paid, and arrange the accommodation if we will be there in some hospital for the clinical attachment. But either you are doing clinical observership or clinical attachment, both are the same things. Hello, assalamu alaikum. This is Dr. Faraz Ahmad. It's very cold today in the Pakistan, so I am sitting at this moment in my blanket and I am having a little bit fever as well. So I'm sorry if my voice is hurting you people. So this is the most awaited video. A lot of people were asking me regarding the clinical attachment and the clinical observership. So I am making this video. In this video I will talk in detail that why it is necessary to do the clinical attachment and how to find the clinical attachment, what are the documents needed for the clinical attachment, and what is the cost of the clinical attachment, either it's free or paid, and how we will arrange the accommodation if we will be there in some hospital for the clinical attachment. Okay, and what will be the duties of a doctor as a clinical observer and the clinical attachee. So how we can search, this is the most important part of this video. I will tell you people that how you can search for the clinical attachment. So what is the best place of the United Kingdom where you should try a clinical attachment, because England is saturated these days. So let's move to the video in a detail. So first of all, I am going to tell you people that why to do the clinical attachment. As you have seen, a lot of people are struggling for their jobs even after clearing the PLAB 2 exam and after having the GMC registration. So I have seen a lot of people who had clinical attachment and the clinical observership experience, they are getting jobs. So I personally did two clinical observership, 1 month before my PLAB 2 exam and 1 month after my PLAB 2 exam, and alhamdulillah, fortunately I have secured a job in the United Kingdom as well. So this is the reason that it is perception these days that if you have a clinical attachment you can easily secure a job. So second thing is that how to find a clinical attachment. So definitely I will talk in detail that how you can find a clinical attachment, but let's discuss few more things before discussing this point. So what are the documents needed for the clinical attachment? So the first important point is your CV. So you should make a very good CV explaining everything from your secondary school, from your high school, and then from your MBBS, your house job, your internship, your post graduation if you are doing some other degree, and everything you should have explained in your CV. I will tell you shortly that how you can make a CV. The other thing is that you should have a visa as well to stay in the United Kingdom for the clinical attachment. So the best way to do a clinical attachment is that once you are in the United Kingdom for your PLAB 2 exam, please arrange your clinical attachment in this visa. You will be on the visit visa, so please arrange your clinical attachment either before the PLAB 2 exam or after the PLAB 2 exam. So the other important thing is that GMC registration. So GMC registration is only needed for the clinical attachment. But if you want to do the clinical observership, you can do the clinical observership without the GMC registration. So I did my clinical observership before my GMC registration. So this is the reason they gave me clinical observership, not the clinical attachment. But either you are doing clinical observership or clinical attachment, both are the same things. So the other important point is that you should have a police certificate. Definitely if you are there in the United Kingdom for the PLAB 2 exam, so you will be having police clearance certificate as well. Other important requirements is occupational health. Few hospital will tell you that you should do an occupational health checkup, and few hospital will not do it. I did my observership, they did not do occupational health checkup, but most of the hospital do this OH checkup. Alright, you should have a valid IELTS and OET certificate. Definitely if you are there for the PLAB 2 exam, your IELTS and OET certificate will be valid. So let's talk about the cost and the accommodation. So most of the hospitals are offering the clinical attachment and the clinical observership free of the cost, but these days few hospitals are charging as well. So they can charge you from 200 to 800 per week. Okay, so the other important thing is that if you have enough money, you can go for the paid clinical attachment or the clinical observership. So please keep in mind, once you will be doing clinical attachment in the hospital, you will be in need of the accommodation as well. You can avail in the hospital accommodation where you will have to pay little amount as compared to the private accommodation out of the hospital. hospital. All right, so what will be the duties of a doctor, of a junior doctor without GMC registration in clinical attachment and the clinical observership? So the main duty will be only you will be allowed to observe the thing, and if you are doing clinical attachment, they will give you permission to do the hands-on procedure like IV cannulation, ABGs, examination of the patient, history taking, and this type of the things. But if you are doing the clinical observership, you will have to just observe the things. All right, so let's talk about that how you can search for the clinical attachment. So this is the most important part of this video. So the first important thing is that you can search on the Google like clinical attachments in the United Kingdom. So this is the lengthy procedure. If you have time in your PLAB 2 exam, you can start right now through the Google. Okay, so the other way is that if someone is working in the United Kingdom, if some of your friend or your family member is working in the United Kingdom, you can ask them, they can talk to their consultant, and if their consultant can allow you, you can do clinical attachment and the clinical observership once you will be there in the United Kingdom for the PLAB 2 exam. So please keep in mind, having some friend or the family member in the United Kingdom, this is the most easiest and the fastest route to get a clinical attachment. So the other way is that you can have a consultant email and you can directly email the consultants. So the important point is that how you can get a consultant email. So this is important thing, that I am in Pakistan, but I don't have the emails of the UK consultant. So how to find the UK consultant's email? So I will tell you shortly that how you can find the consultant's email. So let's move to the laptop screen and I will tell you how you can find it. So please paste the link given in the description in your Google Chrome. So this page will open in front of you. Here you can see that this is the main page of the track website. You can see that if you have email and the password, you can directly sign into your track website account. But if you don't have account, you can directly enter your email and you can click on the create account. Once you will create your account, then it will take to for the creation of your CV. You will have to enter your personal details, your educational details, your internship details, your job details, everything it will ask you, and then you will be able to download the CV. So after creation, you can put your email and your password over here and you will click on the sign in button. So once after the signing in, this page will open in front of you, and here you have to click on the medical and dental option. So this is the page to apply for the job. So from this page I am telling you that how you can get the consultant email. So you will click the your profession like FY1, FY2 or the junior clinical doctor. You will click over here and then you will click on the search button. So here a lot of jobs will open in front of you. You can click in on any of the job. So after clicking on, please come down here, you can see that consultant name, consultant role, and consultant email ID is given. You can copy this email ID, you can email the consultant. Please keep in mind, don't send repeated email to the consultant. Just send one email. If there is response, that's good. If there is no response, don't send them back and back email. So daily you can in this way get 4 to 5 emails. So the last point is that what is the best place for the clinical attachment? So the first thing is that if you are getting a clinical attachment in any part of United Kingdom, please go for it. But these days everyone prefer England for the clinical attachment or the job. So this is the reason that England is saturated these days. So I will suggest that if you can travel, definitely you will be there in the United Kingdom and you will be traveling. So the best way is that please go for the clinical attachment and apply on the clinical attachment either in the Scotland, in the Wales, or in the Northern Ireland. So all these countries are basically part of the United Kingdom. You can apply for the clinical attachment in these countries as well. So there is a less saturation and there is less competition, and I am hopeful if you will apply in these countries, you will be able to get the clinical attachment. Thank you very much.